The way some men reason, one will be left to wonder if their makeup material is from it, not earth. Because Bible said, and out of the dust of the earth, God made man. So there's this couple that I know, the wife got pregnant, and on the D-Day, something happened. She had a prolonged labor. So immediately the doctor and the nurses, they wheeled her into the theater for emergency CS. She gave birth to an adorable princess. Now guess what her push gift was? Right there on the recovery couch. You know what the husband said? Nwa ụmụ nwanyị ndị ọzọ na-amụ, nkwekwuru ya amụ. He literally means the woman is good for nothing. I couldn't believe my ears. You as a lady, if you find yourself in such situation, what will you do? I don't know if the man's pain is the fact that she gave birth to a girl, which was their first child, or that she went through Caesarean section. Please, men, I beg, make una support una woman. It isn't easy. Why do couples see Caesarean section as a taboo? Or pregnant mothers not accepting CS when there is need for that? Now, there is this couple that I know. The woman was pregnant and it was a precious child for the couple. So at the point of delivery, she labored throughout the night and all that. So when the nurses noticed that it was a difficult one, that she's not going to pull through, so they advised her and called the doctor and told her, Ma, the next step is for us to book you for emergency cesarean section. You have to go through that. Let's deliver the baby and make sure you are okay and your baby is okay. Now, to my greatest surprise, you know what happened? This woman refused the offer. She refused to sign consent for cesarean section, and the husband supported her. Both of them, both the husband and the wife, refused to sign the consent for the cesarean section. Now, to cut the whole story short, at the end of the whole thing, we lost the woman and lost the baby. So I don't know. I don't know what people see cesarean section as. If you are in a situation where cesarean section is needed to save your life and the life of your baby, are you going to accept it or will you reject it? What is your opinion on that? What do you think makes people to reject cesarean section? Could it be a religious belief, or could it be another thing, maybe cultural belief or whatever? Let me know your thoughts on that. Thank you. Cesarean section is not a taboo. It is a surgical intervention carried out on pregnant mothers when there is need for that. It can be elective, it can be emergency, it can be planned to save the life of the mother or the life of the baby. Now, there's this client of mine that she already had like 4 kids, normal delivery. She got pregnant for her fifth child. While she was pregnant for the fifth baby, something unusual happened. It wasn't like the first four babies that she had. So at about 34, 35 weeks, suddenly she said she woke up that morning and noticed the fluid dropping down her legs and stuff like that. So she, being an experienced mother, went into the washroom. Lo and behold, it was amniotic fluid flowing out like that. So that means she already had a ruptured membrane. You understand what I mean? And now, to her greatest surprise, the amniotic fluid wasn't clear as it used to be in her other pregnancy. Like I said, she already had experience. So to her, she looked at it, it was colored like red, something like that. So she knew that something was wrong at this point. What did she do? She quickly grabbed the things she could get and rushed down to the hospital. On examination, it was observed that she already had abruptio, placenta abruptio. Yes, what does it mean? Premature separation of the placenta. So once a pregnant mother have that premature separation of placenta, at this point, the important thing is to save the life of the baby and that of the mother. It is a serious obstetrics emergency, serious emergency in pregnancy. So immediately the procedure, everything was explained to the couple. Within minutes of stepping into the hospital, the fetal had changed. That at that point the baby is distressed. So the baby needs to come out anyhow. The baby needs to come out as soon as possible. If not, something will go wrong. So both of them consented, signed the consent form. The woman was wheeled into the theater. Before they know what is happening, she was sectioned, and this is emergency cesarean section. So she was sectioned immediately. The baby was brought out alive but weak. The mother was okay. So after a few minutes of resuscitation, the baby was good to go, and she was handed over to the mother. So this woman did not take it lightly because she was experienced. Even if you're not experienced, during antenatal, the midwife and the nurses would have taught you what amniotic fluid looks like, what you should expect in each pregnancy. So don't play with them. Take it serious. If you notice anything different from what you were taught, kindly rush to the hospital without wasting time to save yourself and save your baby. Yeah. Send this to somebody that you love. It will help some.